updates for you. Starting with the number of patients we're carrying across the Hartford Healthcare, we have about 516 patients across the system. That includes the community network and behavioral health. Our acute facilities right now has 417 patients who are COVID positive across the system. We have about 90 patients who are 89 patients who are PUI. I'll go through the details per hospital. Hospital Central Connecticut has 43 patients and 23 PUI. Midstate Medical Center has 31 and 11 PUI. Hartford Hospital has 201 positive and 27 PUI. Wyndham has 4 patients and 2 PUI. Bacchus has 12 patients who are positive and 1 PUI. Charlotte Hungerford has 18 patients who are positive and 8 PUI. And St. Vincent Medical Center has 108 patients, 15 PUI. We continue to see a modest increase in number of patients across the Hartford Healthcare. We have about 4 to 5% increase day over day at this time. As we had indicated that last time, our peak we're still expecting in last week of April, and hopefully it'll be staying in April and not in the early May, but it could very well be depending on how our community shows the spread, especially in the post-acute settings such as SNF and nursing home and assisted living and group homes, and that remains one of my significant concern at this time as we go forward. We are still tracking according to the model we had with MIT and Hartford Healthcare strategy team. The link to that MIT analytics is www.covidanalytics.io, and I hope folks get a chance to visit and look into that. Some more details about the convalescent plasma donation, and we've treated 6 patients across the system so far, and we look forward to having more donation. As you know, the donation can be is for somebody who's recovered from coronavirus, at least 18 years old, in good health, and there's a process of lab confirmation of being negative for infection. And if you're eligible, please visit our website and register for donor. We have more patients who can benefit from that. We are continuing to work with Rhode Island, New York, and Red Cross at this time to obtain more donations at this time. This time. With that said, we are still exploring use of antibody testing. It's available in Hartford Healthcare as of today. There's research protocols been written up exactly how they're going to be using that. As you read probably and heard over the weekends, a tremendous amount of activity and information coming out of the antibody testing, with New York being testing large number of individuals. Our team of researchers and clinicians are looking into defining the protocols as well. So over the next several days, we'll update everybody on how we end with that. We continue to expand our testing at Hartford Healthcare, and hopefully over the next week, we will share some more exciting information regarding as we go further with that. With that, I have a colleague of mine, Dr. Shawn London, who's an emergency medicine physician at Hartford Hospital, and he's going to be discussing about the clinical innovation. As you know, the Hartford Healthcare's focus on clinical innovation has been quite strong from the beginning, and I think some of the work Dr. London and his colleagues are doing is going to be exciting to share with everybody. Dr. London.
Thank you, Dr. Kumar. So what I wanted to demonstrate a little bit this morning is how we are using some of the technologies that we use for innovation, for building educational models here at Hartford Hospital to try to extend our emergency supplies, if you will, personal protective equipment. We have been doing a couple things. We have been sort of putting together an emergency supply of masks that are sort of our last line of personal protective equipment, as well as basically face shields, because as many of you heard, a lot of the conventional supply chains have become a bit constrained in the midst of what's going on. And what we have been able to do, along with our community partners like Makerspace and some other organizations in the community like the Montessori School of Greater Hartford with things that are sort of readily available like 3D printers and office supplies, we've been able to fabricate basically face shields using office laminate, things that are just around in the community that we don't have to send away for, to make face shields, and things that allow us to extend our conventional personal protective equipment, because our primary goal here, aside from taking awesome care of patients, is to be able to make sure that our staff members are well protected and remain safe. And these devices are great because they're sort of a one-piece thing that you can put on. And our goal is to keep our face, our eye protection, and our masks underneath clean so that we're able to extend their life as much as possible. And at the same time, there are things that we're doing for our staff members just for comfort, because when you're wearing a mask for hours and hours, up to 12 hours a day, we found that it tends to, the elastic straps tend to rub behind your ears. And these are things that no one ever really thought that we would need, but it lets us sort of respond in the moment to what our staff members need, and to make ear protectors that basically sort of go behind and grab the mask and keep the elastic from rubbing off the back of your ears. The 3D printed masks basically let us repurpose existing heating furnace filters, basically, that are basically a polyester filter that filters to the same efficiency level as the material inside the N95 masks, but is clearly in a different format. And what's nice about this material, it is a nicer biocompatible plastic material that actually our staff members, once they're given one, if they, again, this is our emergency supply, if you warm this under warm water with a hairdryer, you're actually able to mold it customized to your face, in addition to making them in different sizes. So just a few examples of some of the things that we've been doing to be able to stretch our supplies of personal protective equipment. And I'd like to open it up to questions, and if Dr. Kumar has any other comments.
Let me come over there. I will. Good morning, everybody. Do you have any questions for Dr. London or for myself at this time?
Hey, Dr. Kumar, this is Emily from The Current. I have a couple follow-up questions about antibody testing.
Yep.
So has Hartford Healthcare actually started antibody testing yet?
We have.
If so, who is being tested, and why did you decide to test those people first?
Thank you. We have capability of testing as of actually for last Friday. Where we are thinking about at the moment is the healthcare workers. Right now, it's going to be research-based. We're trying to understand the prevalence in our healthcare space, healthcare workers. What is the prevalence of this antibody? There's a lot of still unknowns about this antibody. That just having a negative test does not mean that it's a positive test of having somebody having an antibody does not mean you're immune to COVID-19. The data is still emerging as we speak. So we're being very cautious about that, and it's not rolled out for general public or all the healthcare environment. We are looking at the research protocol, trying to understand the point prevalence of infectivity, or that the individuals actually been infected in our community. So currently, as of today, we're looking into only healthcare workers as a part of the research protocol. But over the next week, actually very soon, we're going to be studying a lot more about this, and hopefully we'll come back with a different type of protocol which might be applied to the larger population.
Thank you. And then I had a question about convalescent plasma as well.
Yep.
I know I believe it was on Friday, we talked to Chris Madison, who had donated plasma.
Yep.
Have any other Hartford Healthcare employees donated plasma at this point?
You know, I don't know whether any employee has donated or not. We've had 2 more donations, as best I know. I have to get back to you if there's a Hartford Healthcare employee. I don't believe so. There was several Hartford Healthcare employees have registered that I'm aware of, and they've been tested as we speak for their readiness to be the donor. But I do not know the other 2 members have been Hartford Healthcare employees or not.
Thank you.
Hello, Doctor. This is Brian Hollenbeck at the Day in London. Can you talk about where you stand as far as supplies of the swabs, the reagents, the materials you need to do the testing, the drive-throughs and elsewhere, and how many tests are you doing, and you know, are you comfortable with the number right now?
We continue to really monitor our supply of swabs and viral threats media at this time. However, you know, we've been working with some of our partners, and there's a possibility over the next 24 to 48 hours, we might actually have a significant amount of supply opening up at this time. And I want to keep this conversation till it's final, hopefully by end of the day today and tomorrow or day after. We'll share some more details on that part here. Look, we've been struggling with the supply of the region, especially the VTMs and the swabs for some time. And it's been a challenge. As you know, our community and country needs a lot more testing capability. With even the new supply or new partnerships we're going to be announcing over the next day or two, we still think we need a lot more testing for our community. And I know the governor has been working very hard on that. So over the time, we'll hopefully open this up a little bit more. But this continues to be a challenge at this time.
Thank you.
Dr. Kumar, this is Ajay from Outtakes. Just a quick question. Over the weekend, the state was recognizing that for the first time in this pandemic, we are starting to see the hospitalizations decline, at least for those 2 days. Mm-hmm. Is that the same trend you all are seeing in Hartford Healthcare, or are you all seeing something different?
Yeah, so I think the state level activity, as governor's team had mentioned, was true that there was a bit of a plateau for at least 2 days. For Hartford Healthcare, we've seen continuous increase, and I think it goes back to Hartford Healthcare as a presence all over the state, and we started with the Fairfield County and the New Haven and the Hartford County, and the Hartford County still continues to see the rise. So the total Hartford Healthcare numbers are still on the rise to 4 to 5% day over day. But overall state, if you look at the Fairfield County contingent in that part here, saw a bit of a plateau, and then again a little bit of a rise over the from Sunday to Monday, from Saturday to Sunday. So I think we're going to continue to see the kind of a drift as we had talked about before, from Fairfield to New Haven to the Hartford County, and I think Hartford County is going to see some more increase over the next several days.
Thank you.
We do have a question on Facebook
Sure.
about the masks. So for Dr. London, have the masks been tested for efficacy, and can the virus go underneath the face shield?
So I'll answer the question sequentially. First, they have been tested. We are partnering with some of the folks out in stores in the engineering and physics departments, and they have put together a whole simulator that demonstrates that there fortunately is efficacy of the masks. The virus does go under the face shield, but the sort of the benefit of wearing a face shield as well as eye protection and another surgical mask over whether an N95 mask or the 3D printed materials that you have multiple layers of protection from both droplet and aerosol, that your mask underneath is kept isolated from anything. So when you step out of a contaminated area, you take the top layers off and clean them, and then your mask underneath is left not contaminated.
Are there any more questions, Natina?
Nope,
All good.
that's it.
Thank you. Well, I want to thank everybody for being here again, and look forward to some more information coming out this week, especially tomorrow and day after. I'd like to have the media presence here to share some of the work we've been doing, especially in the lab testing. And over the week, we'll talk more about the antibody testing. I again want to take the moment to recognize all the wonderful colleagues across the Hartford Healthcare who's doing a tremendous amount of work, and all the healthcare heroes and individuals beyond the healthcare supply chain, grocery stores and the food pantries, and all the work that's being done here. And thank you for everybody's hard work to get through this crisis at this time. Thank you.
today we have Dr. Ajay, who's the infectious diseases specialist. So the window opens at 10:45 and it closes at 11:15. So they tend to go a little bit longer on these interviews because they are streaming them on Facebook. So some of them have gone as long as 10 to 15 minutes. Thank you.
All right,
See you
thank
later.
you.
So some of them tend to go a little bit longer. They can be 10 to 15 minutes. But I did submit the questions that you
Sure.
looked at. And then, just kind of do a little demonstration again. I think that's perfect. Anytime you have a show and tell, and especially that piece that you devised for the comfort level.
I should see if I can find a mask with elastics. That way I can put it on.
Oh, you know what, let me call, yeah, that's a good idea. Just a regular,
Yeah, just like a regular elastic surgical mask. I can also see if the Sissy works out.
yeah, that's, I'm calling Steve
Okay.
now.
Hey,